Good morning. I'm Michelle Corson with Kern County Public Health, and I am here to provide an update on COVID-19 and its impact on Kern County. I'll get started with some of the statistics. In Kern County, as of April the 27th at 8:30 a.m., we have 828 cases. That includes 9 non-residents. And we are saddened today to announce an additional death in our community due to COVID-19, which makes our total 5 deaths. Of our current positive cases, 366 are isolated at home, 428 are recovered. That means 96% are either isolating at home and recovering or have fully recovered. And we feel that that remains a very strong and positive thing to be able to let our community know that 96% of our cases fall into those categories. We would like to also discuss the way that we release data. And our department has been following the state guidelines on what level of data can be released while still maintaining compliance with state and federal privacy laws. Members of the Board of Supervisors have recently tasked County Council and Public Health to explore options outside the state guidelines that would allow the release of more detailed geographic information about our residents that have tested positive for COVID-19 while still not violating those individual rights about private medical information. The state guidance document utilizes a pre-established statistical method that assigns risk to the release of health data and assigns limits to what type and detail of information a public entity should release information. However, the document indicates that an independent statistical analysis can be conducted by an expert to explore additional methods of release. So County Council has obtained outside legal assistance with a law firm with significant HIPAA experience on the East Coast to provide assistance, and they have connected us with 2 highly credentialed HIPAA statisticians. Last week, these statisticians indicated that we may release additional geographic information following a defined list of parameters. County Council is finalizing an agreement with this company, and we are awaiting direction. We are optimistic that we will have legal support to release additional data by the end of this week. Another topic I would like to address that we're hearing a lot from our community is causing a bit of confusion is the pending test category when we report out the test results here in Kern County for COVID-19. Medical providers collect specimens from patients suspected to have COVID-19 and submit those samples to a lab to complete the testing process. Any healthcare professional ordering a COVID-19 test is required to report that to our department. Any subsequent positive test results are then required to be submitted to Public Health. However, negative test results are not required to be reported to us. Public Health has been reporting the number of pending tests results daily on our website. This category is comprised of tests that we are awaiting results on from the ordering doctor and test results that are negative, but we have been provided the negative result. In Kern County, we follow up on all test results and trace back even negative results. This process can be delayed since we have to make the contact with the testing lab or doctor or the patient to verify the information and upload the results into our database. And it's really important to note that a lab will report to both the medical provider, who then reports to the patient as to the test result. The separate process is they also notify public health. So even though there is this pending test category on our website that we are awaiting finalization, that doesn't necessarily mean that the patient is waiting for their result, because that communication happens in a completely separate way. We also would like to announce the Centers for Disease Control has added some additional symptoms to be aware of for COVID-19. We've all been used to the symptoms to look for, which are fever, cough, shortness of breath, or difficulty breathing. Recently added to the Centers for Disease Control website are chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. And of course, we always recommend that if you are concerned that you have symptoms that are conducive to COVID-19 as a potential illness, contact your doctor. Do not go to your doctor, call them, or a medical provider and get assistance on what steps you should take next. And finally, we want to stress, continue to stay at home, continue to practice social distancing. This is so important, Kern County. This is not a time to let up on the governor's orders to really take the steps that we know we can do to reduce and flatten our curve here in Kern County. Wash your hands frequently and wear a face covering if you are going out for essential services and you cannot achieve social distancing, which is, of course, staying at least 6 feet between yourself and others that don't reside in your household. And finally, I would just like to remind everyone that our call center remains open 7 days a week, 8 a.m. to 5 p.m. We are here to answer all of your questions. Our website is updated regularly, and that is kernpublichealth.com, and we encourage you to visit that as well. And now what I'd like to do is unmute my media friends. As we continue to practice social distancing, they call in to ask me questions. So with that, I will have my media hit *6, and I have provided a suggested order of questions today, and I would like to start with the first question. I'm sorry, you were muted. I'm ready for the first question.
Hi, Michelle. This is Karen. I was wondering whose decision it was to close until May 15th.
Are you referring to the Kern County?
Yeah, stay-at-home order, how it was moved to May 15th.
Okay, so the May 15th date that I think you're referring to is our county administrative officer has extended essential employees only for County of Kern employees to May 15th. That is a very separate date from the stay-at-home order that the governor has issued. So that is essential staffing patterns for the County of Kern employees that was extended to May 15th. And that came from our county administrative officer. Again, that date has no formal connection to the stay-at-home order that was issued by the governor.
Yes, thank you.
You're welcome. Next question.
Good morning, Michelle. This is Ralph Bailey with Kern Radio.
Hi.
Morning. I'm going to bring up convalescent plasma again. I brought it up at a prior news conference. You told me to call the hospital. I did. 2 of the hospitals told me to talk to Matt Constantine. I said I would, but anyway, let me ask it a different way. Does the county have a position on passive immunity, and are you all telling former patients to go to Houchin, donate their plasma to see if they're a possible donor, and if not, why not?
So I think it's fantastic what Houchin is doing. We're hearing the positive stories as well. Whether or not we are directing individuals to go and suggesting that, I don't have an answer to that. Again, I think it's a wonderful thing that they are doing. So, you know, I can truly dive deeper into that for you and address that better at our next press conference, Ralph. But it's a fantastic thing that is going on. We just don't have a direct role in that process. When we're doing our contact tracing with positive patients and those that they've come into contact with, those are conversations. We have a whole staff working on that, making hundreds of calls every day. But I can look further into any specific recommendations we would have, but I think it's great, and I'm hearing the positive stories that you're hearing too from Houchin.
Does the county have a position on it? Does Matt Constantine have a position that's good, bad, or indifferent?
Well, I think it's positive. So there's no reason that we would be opposed to something like that, especially if it's helping individuals. And the research and the guidance on this, again, kind of extends past our jurisdiction. But I really will look a little more into that for you, Ralph, and you can definitely ask me about that Thursday.
Thank you.
Of course. Next question.
Michelle, go ahead. Thank you. This is Kylie 23 ABC again. So I was just wondering that I talked to a business who said they were partly essential. It was a dog grooming place, and they said that they received a letter from you guys saying that they could reopen that other part of their grooming salon, essentially. Have you guys been giving out any letters saying that businesses could reopen?
So, great question for good clarification. When it comes to the essential businesses, it's extensive. There's some gray areas that the businesses that are deemed essential, we have to kind of refine some of that at the local level. And when it comes to the animal care, dog groomers, things like that, some of those services are definitely deemed essential. So what we do in that case is we evaluate those businesses and we provide guidance at a local level that if they choose to operate under the governor's order, we provide a way for them to do so safely. And that is indeed what we have done. And we also provide that guidance that is on our website. We have a specific tab listed for businesses. So dog groomers would be an example of such a business.
And do you know of any other businesses that are reopening? Because I did talk to a hair salon and a tattoo parlor who said that they were going to be reopening this week. Do you know of any?
Well, I can say when it comes to hair salons and tattoo, they are definitely to remain closed until we get further information from the governor. To my knowledge, we have not provided any direction that they are safe to reopen. And let me be clear, we are not going out and telling businesses that they can reopen at this time. What we are doing with some of those businesses that some of their services fall in that essential category, we are providing guidance to those and working with them so that they can safely conduct business, particularly when part of their business is deemed essential by the governor. And I encourage folks to go to our website because that guidance is there. Next question.
Hi, Michelle. It's Fiona Dager with Channel 29. And I was wondering, is there any more information you can give about the individuals who died, if they had pre-existing medical conditions or what their age is?
At this time, there is not. I did indicate earlier on that we are evaluating with the statisticians how we'll be releasing information in the future. But for now, the only thing I can indicate is that we have a total of 5 deaths in Kern County due to COVID-19.
Michelle?
Yes.
Bob Trice at KGET.
Hi.
Hi there. Are you reporting nursing home positive cases to the state? Because the California Department of Health has a list of them, and a couple of them are Bakersfield area nursing homes, and they themselves have announced positives. What's going on with that?
So when it comes to our local skilled nursing facilities, the state directly works with them. They oversee those facilities, and they are in charge of any investigations. So it's a state oversight, which is unique to some of our facilities in Kern County. So the state does have direct oversight. They also have a website that I encourage everyone to visit, that on the California Department of Public Health, they announce if any Kern County skilled nursing facilities do have COVID cases, in an effort to be transparent and let the communities and families know. So we are aware. What we do with our local skilled nursing facilities is, beginning a couple of months ago, we started meeting with them because of that high-risk population. We met with all the local skilled nursing facilities that would join us, and we started talking about what is your plan as we move into COVID-19 of protecting your employees and your residents, practicing all those safe measures. We also just had a training with skilled nursing facilities last week so that we can best respond and ensure that they are practicing all the safety measures. So we're an education and a support, but we support the state, who then is the one that turns around and reports a positive case. Does that answer your question?
Yeah, but can you say how many people who live in nursing homes are hospitalized or rather just positive, or both?
I would need to refer you to the state, and I know they are sharing that information.
They are, okay.
Next question. Next question.
Michelle, I have a quick question. My last one. I recently talked to a vet who said that COVID-19 could not be transferred from your pet to a human. Is this true?
So, COVID-19 is early, and we are still learning a lot about this. The Centers for Disease Control has some guidance on their website regarding animals and whether animals can transmit to humans or vice versa. The guidance, though, is clear now, especially because we have seen some rare instances. Recently, there were some cats that were tested positive here in the United States. That out of an abundance of caution, as we still learn more about this disease, if you are sick and you are symptomatic, you shouldn't be snuggling with your pets. You should truly be treating them like you would another human when it comes to COVID-19 and the potential to transfer. You should wash your hands in things like that when you're handling animals on a regular basis anyway. So the guidance on the Centers for Disease Control is saying be aware. It is possible. It is not known to be a common source of transmission, but there's just a lot more we need to learn about this. I have time for one more question.
Okay, Michelle, Dr. Erickson has basically gone national now. We hear he's going to be on Fox News. His dissenting opinion has suddenly popped up. I'm hearing from people on the East Coast who've heard about this. Describe how much trouble Dr. Erickson is causing you, Department of Public Health, in terms of getting out an accurate message about this virus.
We had a very active discussion about this last week at our press conference. We just want to encourage our community to remain vigilant and stay the course. Practicing social distancing and staying at home right now is vitally important. And that message is loud and clear. We have not changed that message. And it's not just a Kern County Public Health message. That is a California Department of Public Health message. That is a Centers for Disease Control message. And there is a very robust infrastructure of medical professionals that are providing this guidance to us that we fully agree with. So I just want to take this moment to tell all of our residents, now is not the time to let up. Continue to practice social distancing and staying at home. This is the one thing we can do to flatten the curve in Kern County. And the sooner we do that, we know how eager everyone is to get back to their lives and to get out and enjoy all that is Kern County. And we are with you, and we understand that. But this is not the time to let up. And I just want to remind our entire community our message is definitely still the same in regards to that. And I would like to thank my media friends and thank our residents that are
Thank
watching.
you.
Thank you.
Thanks, Michelle.
And we encourage you to visit our website for regular updates, and our call center remains open. And thank you so much. Stay home and stay safe.